LGBTQ 1 Minute News. Let's queer up health. LGBTQ healthcare faces strain from bias and burnout. In a January 2026 article published in Scientific Reports, researchers write that LGBTQIA+ communities continue to face prejudice, discrimination, and inequities in the healthcare system, which make care harder to deliver and harder to sustain. The authors warn that these conditions contribute to health system limitations that reduce capacity and weaken access to timely, appropriate care. Those same pressures land directly on healthcare workers, especially clinicians serving marginalized communities where emotional strain, staffing shortages, and system instability collide. As demand grows and resources stretch thinner, workforce burnout is becoming a structural issue, not an individual one. If we want affirming care to survive, we have to make sure that people delivering it can stay. You know, I find this very interesting. We've seen a lot of reports about healthcare and things that have come out, and they've never really tackled the aspects of burnout from that respect. And you think about what's going on in our country right now, and our clinicians who work in healthcare systems, you know, the doctor's not the ones, it's not their own individual practice, right? Mm-hmm. So they're doing with what they have to do within the confines of their organization structure and what they're requiring them to do. But at the same time, all the stuff that the patients are bringing to them for issues in the community, it starts to create that stress level, right? And then people are getting behind. There's staff shortages. I see it happening. I can see this now as like a warning label that we didn't see coming.
Wow. And especially if you are empathetic as a healthcare provider, which by all means, ideally everyone should be.
Right.
I would imagine you're going to feel such a struggle because you're the one providing the direct care, but there are regulations beyond your control, as we've seen in the state of Florida.
Right.
And you want to help someone, but then you are literally, you're the good guy,
right,
being made to feel like the bad guy.
Exactly.
Oh, yeah. The poor support for all these healthcare workers that actually do care.
Yes.
And having to deal with this daily. And that's not including their own lives, that they have their own health issues or having to.
What healthcare providers have their own lives?
So then it just, knowing people that work in healthcare, that they care so much and give so much. Mm-hmm. And then that's just emotionally and physically. Mm-hmm. And having to deal with all these people, multiple things, and just sometimes you have to relax and try to let it go, but they can't.
Right. Nope. Mm-hmm. Right. Well, that is an LGBTQ 1 Minute news story. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.